So after the second night, I was released from the hospital and I went home. I had a pretty big bandage on my neck for a couple of weeks and stitches. And I put a lot of ice pack in the hospital. And once I got home, a lot of ice packs on my chest to keep the swelling, in my neck to help keep the swelling and the pain down. A big part of the recovery for me was I also had a lot of neck pain. I think maybe because of the surgery, maybe how my head was positioned. So the recovery wasn't too bad. I was able to be up and do things and make food, and I did try to rest. At that time I was in school, and so I took a little bit of time off, maybe a week, and just tried to give myself some time to recover. Now, some thyroid cancer patients will have to have a follow-on procedure with radioactive iodine, and that is to kill any remaining cancerous thyroid cells in the body. I did not have to have that because my tumor was, I guess, within a small enough range. And then I think they determined that the lymph nodes that they removed weren't actually affected. So it's been 12 years. I did have follow-up ultrasounds for 10 years after my surgery, and there was no recurrence or any new growth in the area. So the biggest part of recovery probably is getting your body adjusted to taking thyroid replacement hormone, and that can take several months. I think for me, it actually took a few years to get on the right dosage. And I had a friend who had thyroid cancer before me, and she told me that I should ask my doctor about taking T3 and T4 instead of just taking the standard T4, which is also known as Synthroid. So right from the get-go, I have been taking T3, which is called Cytomel usually, and T4, again, that's usually called Synthroid, or those are the brand names. So I did have some fatigue getting used to the hormone, but I wouldn't say that it was absolutely debilitating. In fact, the whole process was not debilitating or too painful. So if, again, you know somebody who's going to have the surgery, or you are, I can say that, when it goes well and things run smoothly and there aren't complications, that it's not absolutely horrible. Would I choose to do it again? No, but you just have to deal with these life circumstances.